gonna bring to y'all something a little different today. You know, one of my biggest gripes, even when, I was just nursing, is people who are fucking lazy. When it comes to patient care, I get it. You might take a little bit of laxy approach to something, but you still do it. But blatant laziness is like not the way to be. So I don't care if you're in the ER, ICU, you're on the med surg floor, whatever. When it comes to the bases, and you're talking to somebody that did nursing too, I get it. Staffing ratios, whatever, man. I'm used to having 10 patients on a night shift. That doesn't make an excuse to say, like, oh, I don't want to do something, especially in an ER setting, because you just want to be lazy with it. You got a patient that's 90 years old, and if they come in with anything relating to a possible heart problem, dizziness, syncope, any kind of just odd behavior, hypotension, whatever, like, put them on a monitor. It's like, I just don't understand. Give them a line. Like, they're going to probably need something. If these patients have, an acute exacerbation or an acute heart failure that maybe they didn't have before, and they're trashed at 10%, 15% EF, that's a problem. They might be getting dizzy because their heart literally can't pump out. The diastolic pressures are ridiculous. They got backup in the pulmonary, whatever. Like, these patients, you can't even sometimes get your diagnoses or understand what's going on with the process differentials unless you see something on a monitor. And, I think the approach to thinking, well, if you work at a smaller ER or whatever, and your patients aren't at that acuity level, yeah, they are. Like, people still come. It's still an ER. It's still an emergency room. Like, do the job that you're supposed to do correctly, because that makes a difference. If you see pauses or you see an AFib that you didn't know before, which is causing the backups, like, there's so many different things that come off of it. You know that if they're an acute HF, like, shoot, I got to give them some Lasix real quick, man. We got to get started, because if they got a really bad EF, you need to get that pressure off, or they may code on you. They might have a worsening problem occur in the future. It's just simple things that, we do as nurses that, come on, stop trying to get away with doing shit that's so simple. You talking 6 patches, you talking 1 line, you're talking simple things that can be done. Just get it done. It's my only gripe, I did it too, so we gotta be better as a whole profession, all of us, including myself. But come on, get that shit done right, all right?